Are you really ready to take the NCLEX? Do you really think you're ready? If you can't answer these 5 questions, then the NCLEX will humble you, babe. And we not letting no test humble us. We not letting no test humble me, okay? So this is Ariel's way. Well, I'm so used to saying it, y'all. This is Ariel's NCLEX prep. Okay? And before we start, I am going to be looking over here to my right because the questions are over here. So I don't want to see no cross. I'm not cross-eyed. Okay? Okay. So which patient should the nurse see first? A patient with a potassium of 5.8. B, a patient with a shortness of breath and stridor. C, a patient with a pain rated 9 out of 10. Or D, a patient with a temperature of 101.9. First things first, we read the question. It says, which patient should the nurse see first? First means this is a priority question, okay? And I want you to think, when you see priority questions, a big thing, if I don't see this patient, who will die first, okay? Because that's priority, is it not? If I don't go see this patient, who will die first, okay? So let's look. Number 1, we have potassium of 5.8. We know potassium is 3.5 to 5. If you don't, go check out my lab video, babe. Anyways, 3.5 to 5. 5.8 is a little elevated. And with the elevated potassium, that could lead to ECG changes. But did they tell you we're having ECG changes? They're not. So I'm looking at this person, but I am not too concerned. They're not number 1. B, a patient with shortness of breath and stridor. That goes with ABCs, right? Airway, breathing, and circulation. That is a main. That's breathing. So I am this patient is up here with me. C, a patient with a pain rated 9 out of 10. Yes, this patient is hurting really, really bad. But will this pain kill this person? Not to me. D, a patient with a temperature of 101.9 degrees Fahrenheit. Yes, this person may be at risk for infection. That temp is elevated, right? So we might have some sickness going on. But am I worried about this patient dying right now because they have a high temp? Honestly, I'm not. So out of all of these scenarios, to me, B, airway, breathing, circulation. If this patient cannot breathe, this is the patient who will die first. And let's not forget, ABCs, airway, breathing, circulation, trumps all of these situations, okay? Priority, when we have priority questions, also let the ABC key think. Okay, when we have priority questions, let that ABC, that is a priority framework. Airway, breathing, circulation. Are any of my patients having any issues that fall in this category? If so, you want to keep them at the front of your mind for a priority patient. That answer is B. Next. All right, 2. Which lab value is most important to monitor for a patient receiving IV heparin? If y'all don't get this right on this page, if y'all don't get this right, I'm kicking y'all out the club. I'm kicking you out the club. You need to leave. Okay? So, again, what value is important receiving heparin? We have A, INR, B, platelets, C, APTT, D, hemoglobin. I'm going to keep this one simple. I have a heparin video. Remember what I said. Hep-A-Pro with an appointment. That is your whole sentence for everything you need to know about heparin. Heparin, A-Pro, protamine sulfate is our antidote with an appointment. APTT, that is what we monitor heparin with. APTT, Hep-A-Pro with an appointment, okay? And if you're just like, Ariel, what the are you talking about? Go look at my heparin video. Next! Okay, so a question. A patient on opioids becomes unresponsive with respirations of 6 breaths per minute. What does the nurse administer? Okay, so we do know opioids can cause respiratory depression. That's when we have an opioid overdose. So This question is basically asking, what is the antidote to opioids, okay? So use what you already know. So we have A, flumazenil, B, protamine sulfate, C, naloxone, and D, vitamin K. So if you've been on here with me, then we're going to go to the obvious, okay? B, protamine sulfate. Well, we just already know protamine sulfate is an antidote for what? Heparin, okay? Hep a pro out. So we know that is not the right answer for opioids. Then what do we have? Vitamin K, D. So vitamin K, and I didn't get to make a video on this yet, but for warfarin, another word for warfarin is Coumadin. Coumadin, vitamin K. Vitamin K, okay? So no, that is the antidote for warfarin. And so then we have at the top flumazenil. This is an antidote for benzodiazepines, okay? So giving this for opioid would actually do nothing. And how I remember that, I flew in the bins, okay? I flew in the bins. She be flying in the bins. I flew in the bins. Okay, so that only leaves us with one, which is C, naloxone. So this is our antidote for opioids. So use what you know. If you already know that, like I said, protamine sulfate is for heparin, of course that is not the antidote for opioids. And if I just told you that warfarin is also called Coumadin, vitamin K is antidote, cross that out. Flumazenil is for benzodiazepines because she flew in the bins. It leaves us with C, okay? The answer choice C. So let process of elimination also help you out. Next! Okay, so this one is asking, which patient requires airborne precautions? I personally feel like this is one of those things you know or you don't. So A, influenza, B, C. diff, C. tuberculosis, or D. MRSA or MRSA wound infection. Okay, so when I was in school and I was learning precautions, the very first thing I learned was MTV on air. Y'all remember MTV when it used to come on TV? On air is the TV. Now, if you're too young for that, then that's what the on air means, all right? So MTV on air. MTV is measles, TB, varicella, okay? So this would have been very easy if I know MTV on air, measles, TB, varicella, boom, got it. Whereas A, the flu, is droplet precautions, okay? So we have to wear a mask, but no negative pressure room. Where B, C. diff requires contact precautions, okay? We need gown, gloves, soap and water. If you ain't never been around a C. diff patient, you are going to understand why you need every piece of PPE up in that thing, okay? And D, our MRSA, that is also contact precautions. That is not spread through air, okay? So the same thing with C. diff. We're gowning up, we're gloving up, we use soap and water masks, okay? Next! All right, so this is asking, which task can the nurse safely delegate to the UAP? A UAP is unlicensed assisted personnel, okay? A, teaching incentive spirometer use. B, assessing lung sounds. C, obtaining vital signs on a stable patient. D, administering IV antibiotics, okay? So this is saying, as a nurse, what can I delegate for you to do? And then really let the words help you. And I'm about to show you how it's helping and breaking down. A, teaching incentive spirometer. You cannot teach anything. They cannot teach anything, okay? So that's automatically out. B, assessing lung sounds. That is not within their scope to assess. And C, obtaining vital signs on a stable patient. Okay, it's in their scope to get vital signs. And this patient is stable. Now, if this said obtaining vital signs on an unstable patient, would I still let them do it? We'll see. D, administering IV antibiotics. They cannot administer any medication. That is outside of their scope. So from what we're looking at, the only thing that they are able to do that's within their scope is C, obtaining vitals on a stable patient. But like I said, don't let the words trick you. Stable. Stable is the key word in this. If this said on an unstable patient, they would not be able to. That is outside of their scope, okay? So that was just some quick NCLEX prep for y'all. If y'all didn't get them 5 questions right, it's okay. You just know what you need to go work on, okay? And if you did, let's go, nurse! Let's go, nurse! If you enjoyed this, y'all, let me know. We can do more questions if y'all like. And again, this is Ariel's NCLEX prep. See y'all later.